Let's move on to treatment for relapsed chronic lymphocytic leukemia. There was a 4-year update today, yesterday actually, here at ASH 2019 by John Seymour, a 4-year update on the MURANO study. So maybe Stephen, you can summarize what that update told us about the MURANO study and outcomes for patients treated with venetoclax in the relapse setting.
So the MURANO study was a randomized phase 3 study comparing bendamustine rituximab or Rituxan with the experimental arm of venetoclax with rituximab. It was a fixed duration of 2 years treatment, and what was really impressive about this study is not only was the experimental arm vastly superior in terms of both progression-free and overall survival, but there was a high rate of MRD negativity in a pre-treated population. So patients who've received prior treatment, they've got adverse biologic features. There's high rates of 17p loss, TP53 mutation, and so to achieve MRD negativity in this group of patients is a tough job. And it does seem to be in patients, even with adverse biological features, if they attained MRD negativity, they often had quite a durable treatment-free interval. So it does look like a useful combination. The one problem with the MURANO study is it was largely done before patients had been treated with ibrutinib, so we don't have data on whether that strategy is useful in people who've received frontline BTK inhibitors.
Dr. Ma, you were involved in the trial that preceded the MURANO trial, the 365, the phase 1b clinical trial. If we're talking about fixed duration therapy, I think the concept of retreatment and whether or not patients are expected or anticipated to respond to retreatment, I think that the original trial allowed for patients to come off treatment, and then there were patients who were retreated when they progressed or relapsed. Maybe you could give us an idea about what's been seen with that and what are the thoughts on retreatment after relapse with a fixed duration type regimen.
Right. So in the original phase 1b study, the protocol is written that once the patient are able to achieve either a undetectable MRD status or a complete remission, then they have the option of either continue on the single agent venetoclax or to stop treatment and then be retreated, allowed to be retreated if they have progression later on. So we have actually patients who are continued on the treatment, and we have patients who actually stopped on the treatment. And this year, at 2019, we have updated data from this study, so that'll be interesting to see. But for patients who stopped treatment, we do have a few patients who actually progressed and restarted on treatment. And when we're restarting on treatment, we're doing venetoclax plus this 6 months of rituximab again. Most of those patients actually were able to achieve initial response. One patient did actually later on progressed after starting on the treatment again, but the other, I think 7 or 8 patients were still able to continue on the treatment and maintain a response. So retreatment is definitely a potential feasible strategy.
And we don't anticipate that they're necessarily going to be refractory to treatment when we initiate subsequent or retreatment.
And at least not so far from the day, but it's a very small number of patients. I think that's something that needs to be tested in a clinical trial